Hello everyone, I'm very glad to see you again. Today we will focus on the second step, suction and scanning. Suction and scanning is a core step of the SMILE procedure. If the patient can cooperate well and the previous docking is performed exactly according to the standard procedure, then this step will be very smooth. Otherwise, unexpected issues during suction and scanning often lead to the forced termination of the surgery. A stable suction serves as the foundation for a successful scanning. The most common factor affecting suction stability is the patient's non-compliance, leading to loss of suction. We name it passive suction loss, including eye, head, or body movements, or eye squeezing. Other factors include excessive tears during suction, as well as the lash and conjunctival parts were sucked into the cone. After suction loss, it is difficult to maintain a fixed eye position, resulting in a loss of accuracy in laser scanning. If any of the above situations occur, suction should be immediately released. The cone and the ocular surface should be cleaned by a new sponge, and then a redocking should be performed while avoiding lashes and conjunctiva. The other type of suction loss is initiated by the surgeon, typically occurring when the patient is unwilling or unable to continue cooperating, or unexpected situations such as large dark spots occur during scanning. To minimize unnecessary tissue damage, the surgeon will terminate laser emission and release suction. A major advantage of SMILE surgery is that any unexpected occurrences during the scanning, as long as the surgery is stopped without separating the lenticule, will not affect corneal structure and biomechanical properties. The surgery can be rescheduled after corneal stromal healing. This study has been published in the Journal of PLOS ONE. To avoid passive suction loss, thorough patient education is required preoperatively. Familiarizing patients with surgical steps and their cooperative tasks. Before scanning, it is necessary to confirm a good docking and a stable suction. During scanning, keep talking with the patients to guide them in maintaining a stable eye position until the scanning is complete. Personally, I suggest informing patients of the remaining time using a countdown, which can encourage them to cooperate.
5, 4, 3, 2, 1. Perfect.
If eye movement occurs early in the scanning phase, when the scanning area is still beyond the optical zoom, suction remains stable, no obvious dark spots are present, and the patient has spontaneously restored correct eye position, scanning can be continued until completion. If a complete suction loss has occurred, but the scan is far from the optical zoom, and there is no unintended layer cut, rescanning with initial settings can be performed after re-establishing suction. If suction loss and unintended layer cut occur during scanning of the optical zoom, it is recommended to terminate the surgical procedure and wait for a period of 2 to 4 weeks until the tissue in the laser scan area has healed. The new surgical design proposes to encapsulate the initial laser scan area with a new lenticule, or consider alternative surgical methods, such as surface ablation, femtosecond laser-assisted LASIK, or implantable polymer lens implantation. If suction loss occurs during side cut or incision scanning, it is recommended to re-establish suction and repair the side cut or incision scanning. We also tried using a needle of a 1 ml syringe to manually create a small incision. Dark spots with a diameter of less than 1 mm have no significant impact, but with a diameter of 2 mm or more, often encounter greater resistance during lenticule separation. When large dark spots appear, scanning should be held. If large dark spots are caused by lipids, bubbles, or secretions, rescanning with initial settings can be performed after cleaning the ocular surface. If large dark spots are caused by corneal opacity, especially within the optical zone, it is recommended to immediately terminate scanning and consider alternative surgical methods, such as surface ablation or ICL implantation. Fortunately, all the patients mentioned above who experienced intraoperative complications ultimately achieved excellent vision, and none of them lost one or more lines of vision. Take-home messages. Excellent patient cooperation is key to the successful completion of the scanning step. During the scanning phase, in the event of any unexpected occurrences, it is always advisable to immediately halt the scanning, as a repair scanning usually does not impact visual outcomes. Next time, we will explain how to separate and extract the lenticule. See you next time.